So on the first story, government is being accused of breaching an agreement to pay up the salary arrears of dozens of nurses. Now, the agreement was reached in September following weeks of agitation by the health workers. Now, collectively known as a coalition of unpaid nurses, they've been agitating for this to happen. My colleague Hannah Odame caught up with spokesperson for the coalition, Douglas Edu Foko.
Coalition of Unpaid Nurses has served notice that on the 31st of January, they will embark on a strike. They will lay down their tools because, according to them, government has not been fair with negotiations with regards to their unpaid salaries, which have been in arrears, some as much as for 21 months. I have with me a spokesperson of the association, Douglas Edufoko, to tell us exactly why they intend to embark on the strike, despite all the promises and assurances the government has given them that their allowances will be paid. Douglas, I know some of your members were paid, so why are you still going on the strike?
Exactly. Some of our members were indeed paid, but it's not all the 7,000 as perceived within the public sector. I mean, only 30% out of the 7,000 were paid. And even those who were paid were not paid fully. We have some of them who the government owes about 12 months, 11 months, 14 months, and the likes. But they were paid only 4 months out of that specific amount. As we speak now, I have evidence of 20 people in only Western region who have worked from 11 to 21 months without a single salary, which is very disheartening.
I know that your mother organization, the Ghana Registered Nurses and Midwives Association, is negotiating and also intervening in this matter. How far has that been, and what's their input with regards to this particular threat that you have issued?
If I tell you that they are not doing their best, then I'm lying to you.
Despite all of this, you still have the discrepancies in the salaries?
Exactly, because they assured us that hopefully by the end of September, every individual will be paid fully.
And that's the reason why you returned to work on the 8th of October, if I remember.
Exactly, because the persuasion they used worked on us, and we were much convinced. When the government introduced this 3-month directive policy, did the ministers, I mean the MPs, who collected their salaries with arrears, did they fill anything like arrears forms? No, they never did. The doctors who embarked on strike and they were paid fully, did they fill any arrears forms? No, they didn't. So why nurses? Is it not being biased? Is it not bias? Is it not injustice? So where is the justice that we are talking about? We are celebrating Xmas, but we are celebrating the Xmas with sadness, because some of us are being, we borrowed money from people and they are now harassing us. We go to work, we can't even smile to our patients because we are already traumatized. We are going through so many psychological trauma, which is not good for our healthcare. Because if you claim we don't have money, but we have money to allocate for other ministerial or sectors to paint buses, then I think the government is being unfair to us.
And so, as you have heard from Douglas, nothing will convince them to return to work on the 31st of January 2016 unless government this time round pays every salary that they owe all the nurses. They mean their words, and government is over to you. My name is Hannah Odame for Joy News.
So, even as the year draws to a close, nurses are still agitating, and this has been a theme throughout the year. In fact, as far as the health sector is concerned, 2015 will draw to a close shortly. It's just right for us to do a certain review of the year as far as this sector is concerned. Let's speak now to Gabriel Benakwe, who is the national chair of the Coalition of NGOs in Health. He joins us on the telephone line right now. Thank you, sir, for your time here on NewsDesk. I wonder for you quickly, before we even delve into some of the key issues, if you look back on 2015, what were the key health issues for you as far as the sector is concerned?
We do Ghanaians well in this Christmas. I hope that there will be prosperous 2016, especially that we'll be going into another general election. But 2015 has been a lot of strategic issues that have drawn national and international stakeholders' attention to how Ghana is transforming the health sector. And one of the critical issues we have had in 2015 is the what is popularly called the doomsday issue, where it affected the health sector very grievously. The second issue is the doctors' strike. Doctors and nurses and other allied health workers, they're like the mental health workers, also embarking on strike. Then more strategically, the government of Ghana initiated the presidential initiative on the community health service planning compounds, which in the popular is called CHIP compounds. And then lastly, the re-strategizing of the National Health Insurance Scheme. These are the major issues that happened in 2015.
And also, I think this year, it started the year with this fire, the Central Medical Store. That was a big, big, big issue for the health sector. Won't you agree?
Yeah. I was going to mix that one with the issue of the doctor's strike and the health sector, but thanks for that. The other issue is the disaster that also happened in major towns like Accra, major market centers. It's also affected a lot of health interventions. Things that government would have used, resources the government would have used to support ongoing health projects were also affected. So this has been very critical strategic issues that have affected the performance of the health sector in the country.
Now, let's look at some of the key ones. Obviously, one of the most important ones that affected lives were lost, etc., was the doctor strike, and it lasted for so many months. Do you think we've gone past the stage where doctors calling strikes will be over, said that in 2016 we'll not return to a situation where doctors will say they're calling a strike? Have all these issues been dealt with adequately this year?
Yeah, if you recollect, the Ghana Coalition of NGOs have made a lot of strategic interventions, doing press releases, advocacy, engagement to draw government attention to what was happening in these major sectors that I just mentioned. A critical example is our position on the doctor strike, which we made it severally on your platform and other platforms. And also the issue of the central medical stores, the proactiveness of government, especially when reports were supposed to be available for certain decisions which delayed, so it also affected. We also have made a lot of influencing engagement to ensure that the National Health Insurance receives the necessary regulatory framework amendments and also overhauling their administrative system to ensure that public-private partnership is materialized to ensure that the National Health Insurance is sustained. So these are the issues. But on the performance of how the various ministries and sectors and government dealt with the issue, I will say to the point of the coalition point of view that we have not been very, very appreciative of the fact that certain processes and pronouncements by certain key government officials have been made instead of taking strategic measures to address the issue once civil society raised them. So moving into 2016, we do not think that such process should be rolled over into 2016 because, one, universal access to health is a human right. And so any person who is contributing to the health reform of the country ought to see this universal principle so that they can work assiduously to ensure that people who are supposed to enjoy health services really enjoy this and they really have access and it is affordable and it's also within the standards that the UN Convention have stipulated for all countries, especially Ghana, as a member of it. The other issue we want to see in 2016 is that currently the health budget is still inadequate. It will take some time to push for additional funding. But what we want to see is that health accountability should become the topical issues in all districts, all regional and all national health facilities and at the ministry, because we have a lot of evidences that have revealed that sometimes funds moving from national to regional and district are not in the best interest of ordinary Ghanaians. And we will want to engage these various ministries, districts, and the national offices to ensure that within the circumstances that we may find ourselves, that is inadequate funding in the health sector, we will still have to ensure that every CD is pushed from national to regional and to district, so that the sub-districts, especially the chief compounds, can be more empowered to be able to deliver quality and affordable health services to the ordinary Ghanaians in the country.
I would like us to focus briefly on the National Health Insurance Scheme. Next year will be a very important year for that scheme. Government consistently have said that we've seen, I guess, a record number of people signing on to the National Health Insurance Scheme, and they point to that as a major success and a major achievement. Does the fact that we have more people, as government claims, on the National Health Insurance, scheme, does it necessarily translate into an efficient scheme, one that people can benefit from? Because you hear the other side of the story that says, well, people go to the hospitals and you're asked to pay before they can, in fact, access healthcare. What's the coalition's assessment of that?
Yes, we have learned from what is happening now, especially having participated in some of the national stakeholder review meetings, health summits, about the performance of the national health insurance. Nonetheless, they themselves have admitted that, yes, they are not doing well. They are not reaching out to ordinary Ghanaians. They are not improving on their services as people have advocated for. So we want to see a more robust administrative regime in 2016 where, one, they should be able to have a new arrangement, which normally I call the public-private partnership arrangement, to scale out registration for ordinary Ghanaians to have access to insurance scheme or services. That is one. Two, we want to ensure that we will collaborate with National Health Insurance and other anti-corruption bodies to ensure that even the few people who are registered actually get adequate and timely services when they really need health service. Then three, we are going to embark on a national advocacy. In fact, we operate in 201 districts out of the 216. We want to embark on a national advocacy and national monitoring tracking services where we want to find out how the National Health Insurance is actually performing and provide them alternative reports on how they should improve on their services, and where we need to ship, we will actually ensure that we really ship whoever is responsible to provide the necessary healthcare services to the ordinary Ghanaian that we represent in the country.
Okay. Thank you very much, Gabriel Benakwe. He is the National Chair of the Coalition of NGOs in Health. You're still listening to News Desk. This is the Christmas Day edition. My name is Evan Smith. So we'll take a short break. We'll be right back with more, telling the stories about how a poor family is also marking today. You might spare a thought for them also as you enjoy your day. We'll be right back.